I'm super excited to see this network come to fruition. I think it will be fantastic for not just the people who are in the community now working, but also for the people who are thinking about coming.
Goldfields Health Professionals Network is a collaboration of local healthcare organisations who've come together to provide one hub where professionals can come in and network, share resources, education, training and referral pathways, and this in turn will lead to better healthcare services within the Goldfields region.
When you start, like we are one facet of a larger health network, and we need to know when we need to refer to other people, when we need to get other health professionals involved. So having the other, physios and osteos and podiatrists, the medical doctors involved is going to be crucial, because without that rapport, without that connection and that knowing of who to and where to send people, you're driving blind.
It's a great idea because just connecting with GP, for example, getting referral, establishing communication, just so that we keep everyone on board together.
So we are continuously networking and getting rapport, constantly referring patients, vice versa, backwards and forth. And it's just great to have that rapport with the other health professionals that are located in Kalgoorlie. Because we don't know other health professionals, how we're going to refer on.
It's really important for our patients that we know what services are out there, and it's always changing what private and other health services there are. And yeah, it's much easier to refer people or liaise if you actually know them. And in a town this size, there's no reason why we can't know each other. And it makes it a lot more satisfying or pleasant if you're dealing with someone who you know.
To have everything you need in terms of your professional networking all in one place is so convenient and so easy, and there's really no excuses then for us to get bigger and better.
Because you're so remote, like these further development, these seminars and events are normally in major cities. So there's time off work, there's cost to travel, that sort of thing. So, and we need to do it. Like we have a certain amount of hours every year we have to do to continually to upskill and learn. So having things locally would be a massive time saver, cost saver, and invaluable, knowing that people are coming out to these communities to be part of that.
If the network was to be able to provide some professional development courses, I think that would be super beneficial for the professionals living in Kalgoorlie, purely because at the moment we have to take time off work to then be able to travel to metro locations to participate in CPD courses.
Especially as an employer, to be able to speak to potential candidates and say, look, we actually have these opportunities for professional development, for networking, is such a massive draw card. Like these days, everyone wants to further themselves. Everyone wants to promote that evidence-based practice, and the only way to do that is by connecting and networking and having these sort of opportunities that the Health Professional Network is going to offer.
The health professional networking is really important in a rural area. It can be quite an isolating, and for new doctors, whether they be registrars or international medical graduates, rural practice can be very confronting, and a lot of people probably don't think they have the skill base to work rurally. So I think it's really important that people do feel really supported.
We like to be involved in that network so that the future doctors and the medical professionals who come here will not be having that kind of queries in their mind when they first come to the city.
I think it would be beneficial because it would involve like-minded people who have similar goals and similar aspirations, but also similar challenges, and it would give you the opportunity to speak to other people, to network with other people, and to problem solve together.
Be holistic in the way we care for people and break down those barriers in terms of best evidence. I think you'll see optimal health.